the pathology of acute kidney injury, the causes of acute kidney injury, the management of this AKI, and the different types of acute kidney injuries. Okay. So what is acute kidney injury? Acute kidney injury, or AKI, is abrupt reduction in kidney functions. Okay. And as evidenced by change in the laboratory values like serum creatinine, urea nitrogen, sorry, the blood urea nitrogen, and urine output. Okay. So change in the evidence of these, the change in the values of these laboratory outputs is going to be the reason, or going to be the evidence for the acute kidney injury. Okay. So acute kidney injury is diagnosed if one of the following criteria is met. So these are the criteria. If these kind of symptoms is going to be experienced by the patient, then that patient might be suffering from acute kidney injury. So increase in serum creatinine level, okay, of at least 0.3 milligram per deciliter within 48 hours, and a 50% increase in baseline serum creatinine within 7 days, or a urine output of less than 0.5 ml per kg per hour for at least 6 hours. Okay, so these are the indications for acute kidney injury. So what is epidemiology and etiology of AKI? Between 5% and 7% of all the hospitalized patients develop AKI. Why? Because of continuous, because of the less movement, because of continuous, because they're continuously lying, and because of restricted movement. Okay. And the various other, because of the influence of various other kind of drugs. Okay. So, a greater prevalence of acute kidney injury is found in critically ill patients, in the ICU patients, or ICU acquired acute kidney injury. Okay, so basically, those patients who are in hospitals for a longer duration of period, for months, for 1 month, 2 months, 3 months, so that patient develops acquired acute kidney injury. Okay, and despite improvement in the medical care of individuals with acute kidney injury, mortality generally exceeds 50%. Okay, so mortality is, it is high in case of this acute kidney injury. What is the pathophysiology, and what are the typical categories of acute kidney injury? So acute kidney injury is going to have three major category: pre-renal category, or pre-renal acute kidney injury. Second is the intrinsic acute kidney injury, and third is the post-renal acute kidney injury. Okay, so these are the three categories. In the first category, that is the pre-renal, it means the infection or the disease or the damage is before the kidney. Okay, this is the kidney, this is your renal, this is your uh, so before this kidney, in this area, in the renal artery, in the blood vessels, if there will be any kind of blockage or injury, that is going to known as the pre-renal acute kidney injury. Okay, and intrarenal acute kidney injury means there will be direct damage to the kidney, direct damage to the nephrons. Okay, and that may be because of some kind of inflammation, certain kind of drugs, toxins, infections, or reduced blood supply. Okay, so that is going to cause intrarenal, or you can say intrinsic acute kidney injury. Okay, then the third kind of acute kidney injury is the post renal injury. Okay, or post renal AKI. So if there will be sudden obstruction because of, see this picture here, number 3 where 3 is written. So in this area, it is known as, this area is known as the post renal area. Okay, so if there will be injury in this region, so that will be known as the post renal acute kidney injury. Okay, so the injury might be in the ureter because of the blockage. The injury might be in the bladder, or it might be in the prostate area in case of men, and in urethra. Okay, so these are the specific areas in which acute kidney injury can be seen. Okay, so what is pre-renal acute kidney injury? This one, what is pre-renal? This area. Okay, so pre-renal means it is characterized by reduced blood supply or reduced blood flow to the kidneys. Okay, if you take an idea about the cardiac output, if you talk about the cardiac output, then you can easily understand that the 20% of the cardiac output goes to our kidneys. Okay, means out of total of your cardiac output, out of that 100%, 20% is directly supplied to our renal system, to our kidneys. Okay, so if that 20% is reduced abruptly, that is going to cause pre-renal acute kidney injury. Okay, so what are the common causes of acute kidney injury or pre-renal acute kidney injury? It is a volume depletion because of excessive loss of blood. Okay, maybe during surgery, maybe during any accident, or because of dehydration, or because of gastrointestinal fluid losses. Okay, so these factors are going to affect directly our kidney. Okay, so decrease effective circulatory blood volume. Okay, the blood volume in the body will be decreased. Generally our body contains, normally our body have 5 to 6 liter of blood. Okay, so if that 5 to 6 liter is going to decrease abruptly, suddenly, then that is going to decrease the circulatory blood volume. Okay, and that might be because of decreased cardiac output, because of certain kind of congestive heart failure, maybe because of the myocardial infarction or the hypertension. Okay, it may be because of the pulmonary hypertension, liver failure, or any kind of infection or sepsis. Okay, then functional, what kind of drugs that can be used to treat this pre-renal acute kidney injury? It might be some kind of non-steroid anti-inflammatory drugs, or cyclosporine and tacrolimus can be used. So prompt correction of volume depletion can restore kidney function to normal, because no structural damage to the kidney has occurred. Okay, so if the damage to the kidney is pre-renal, so that pre-renal kidney acute kidney injury damage can be corrected. It is reversible. Okay, if you treat this pre-renal acute kidney injury with the by increasing the volume of the body, by increasing the blood volume, by increasing the fluid volume, so you can give you can just if the blood is not available, if the correct match of blood is not available, then you can just start with the IV therapy. Okay, that will also help in the preventing this pre-renal acute kidney injury. Okay, so this pre-renal acute kidney injury is the most common kind of injury, which is like experienced by 55% of the patients, and represents a physiologic response to mild to moderate renal hypoperfusion. Okay, and the pre-renal acute kidney injury is rapidly reversible upon restoration of renal blood flow and your glomerular ultrafiltration pressure. So more severe hypoperfusion may lead to ischemic injury of renal parenchyma and intrinsic renal acute kidney injury. Okay, so if this if this intra this intrinsic if this pre-renal, or you can say if this pre-renal acute kidney injury is not treated on time, is not paid attention to, then it is going to damage the internal structure of the kidney. Okay, so it will damage the renal parenchyma, it will injure the other important structure of the kidney, and that will cause the intrinsic or the intra-renal acute kidney injury, that is more severe as compared to the pre-renal acute kidney injury. Okay, so, thus pre-renal acute kidney injury and intrinsic renal acute kidney injury due to ischemia. Ischemia means decrease in the blood supply. Okay, or the the sudden decrease in the blood supply to a certain organ. Okay, a part of a spectrum or of manifestations of renal hypoperfusion. Then, what are the causes of this pre-renal acute kidney injury? That may be because of hypoperfusion, maybe hypovolemia. Okay, decrease in the volume of the blood, decrease in the volume of the ICF or the ECF, because of burn, accidental cases, cardiogenic shock, thromboembolism, sepsis or anaphylaxis shock, renal artery stenosis, or hepatorenal syndrome. Okay, so these are the causes for the pre-renal acute kidney injury, and there are certain nephrotoxic drugs that can also cause the acute kidney injury, and those are the beta blockers. Okay, certain kind of ACIs and diuretics and certain chemotherapy also decreases the function of the kidneys. Okay, decreases the urine output, decreases the it is going to affect the renal system of our body. Okay, so these are the causes for the acute kidney injury, that in case of pre-renal. Okay, so etiology and pathophysiology is for the hypovolemia. It may be hypovolemia means decrease in the body fluid volume. It may be decrease in the blood, maybe decrease in the blood volume, maybe decrease in the body fluids, other body fluids like the plasma, the ECF or the ICF. Okay, and that may be because of dehydration, maybe because of hemorrhage, certain kind of burn, gastrointestinal fluid losses like vomiting or surgical drainage or diarrhea. Okay, so these are the causes. These are the causes for the hypovolemia in pre-renal acute kidney injury. Okay, then um, okay, so after that, yeah, so renal fluid losses and certain kind of diuretics like osmotic diuresis, example in case of diabetes mellitus, certain kind of osmotic diuretics are used that may also cause acute the pre-renal acute kidney injury. Okay, and sequestration in extravascular spaces like pancreatitis, peritonitis, trauma or certain kind of burns and severe hypoalbuminemia. Then the second cause for the pathophysiology for the pre-renal acute kidney injury is the low cardiac output because of myocardial infarction, because of the diseases of the myocardium, okay, because of the disease of the valves of the heart, and because of the disease to the pericardium, arrhythmia, or the tamponade. Okay, and other reasons for the low cardiac output is the pulmonary hypertension, massive pulmonary embolus. Okay, then altered renal systemic vasoresistance ratio, systemic vasodilation, sepsis, anaphylaxis. For renal hypoperfusion with the fourth is renal hypoperfusion with the impairment of renal autoregulatory responses. So these are the pathophysiology for the pre-renal acute kidney injury. Okay, so hypovolemia leads to glomerular hypoperfusion, means when there will be less volume, there will be less fluid inside the blood. So the GFR rate also decreases. Okay, so but filtration rate are preserved during mild hypoperfusion through several compensatory mechanisms. And during states of more severe hypoperfusion, these compensatory responses are overwhelmed and GFR falls, leading to the pre-renal acute kidney injury. So there are certain non-steroidal anti-inflammatory drugs. They reduce the afferent renal vasodilation, and this ACE and ARBs category of drugs limit renal efferent vasoconstrictions. Pre-renal acute kidney injury can complicate any disease that induces hypovolemia, low cardiac output, systemic vasodilation, or the selective renal vasoconstrictions. Then the second type of acute kidney injury is the intrarenal or intrinsic acute kidney injury. Okay, so what is this intrinsic or acute or this intrarenal acute kidney injury? That may be glomerulonephritis. Okay, that may be ATN or AIN or tumor lysis syndrome, and that might be because of certain kind of drugs, like certain kind of nephrotoxic drugs, like certain antibiotics like rifamycin and the tetracyclines or aspirin. Okay, and certain chemotherapy also causes intrinsic renal acute kidney injuries. Okay, heavy metals, anti-hyperlipidemics, antifungal and antiviral or ACE inhibitors also aggravate, or it is going to cause the intrinsic renal acute kidney injury. So in intrinsic acute kidney injury, in this particular condition, the damage is within the kidney. Okay, basically the nephrons are going to be damaged because of the increase in the pressure, because of low blood volume, because of certain vascular damages will be there. Okay, and glomerular damage, that is nephrotic or nephritic glomerulonephritis. Then the other causes for the acute this intrinsic or intrarenal acute kidney injury is the acute tubular necrosis, that is ATN, and it accounts for 50% of all causes of AKI. And the reason for this acute tubular necrosis is the ischemia. The endogenous toxins like uric acid, hemoglobin. Exogenous toxins are the aminoglycosides, contrast induced nephropathy, and amphotericin B. And acute interstitial nephritis, that is AIN, is maybe because of certain kind of non-steroidal anti inflammatory drugs and infections. And pre-renal acute kidney injury can also progress to, if pre-renal acute kidney injury remains untreated or remains unattended, that will lead to the intrinsic or intrarenal acute kidney injury. Okay, then accounts for this intrinsic or intrarenal kidney injury accounts for 40% of all kind of acute kidney injury. And here it is written, acute kidney injury, the intrinsic part is going to be maybe because of glomerular injury, vascular injury, interstitial injury, or injury to the tubules, means injury to the collecting duct, injury to the PCT, DCT, Henle's loop. Okay, that might be damaged. Then Acute tubular necrosis like ischemia as for pre-renal acute kidney injury, hypovolemia, low cardiac output, and renal vasoconstrictions, systemic vasodilations. So if these conditions remain untreated, that will progress to the intrarenal or intrinsic acute kidney injury. So what is the pathophysiology for this ischemic acute kidney renal failure? So what is ischemia? Ischemia means the sudden decrease in the blood flow, sudden decrease in the blood supply to a particular area. Okay, and ischemia might be like this: the organ will not get sufficient amount of blood. So what will happen if the organ will not get sufficient amount of blood? Then the oxygen will also not be available. Okay, because blood carries the oxygen. Okay, so the oxygen level is also going to drop. So the low oxygen level is going to cause some kind of glomerular or the medullary damage. Okay, so tubular, it is going to cause this low oxygen level will cause certain it is going to create certain kind of pressure on the tubule. So it cytoskeletal breakdown, loss of polarity, apoptosis and necrosis, discohesion of the viable and necrotic cells, tubular obstructions and back leak. And all these factors is going to inflate the process, and there will be inflammatory responses, and vasoactive mediators will is going to release, and that will cause the vasoconstriction in response to the endothelin, adenosine, angiotensin 2, thromboxane A2, and the leukotrienes and sympathetic nerve activity. So what will happen? There will be the vasodilation in response to the nitric oxide, and endothelial and vascular smooth muscle cell structural damage will increase, and that will lead to the leukocyte endothelial adhesion, vascular obstruction, leukocyte activation, and inflammation is going to increase, and that is going to damage the internal structure of the kidney. Okay, there are certain toxins that also damage the kidney, like the radiocontrast, cyclosporins, antibiotic, chemotherapy, organic solvents, and these kind of substances is going to affect directly our tubular system. Then the third kind of acute kidney injury is the post-renal acute kidney injury. Okay, in this post-renal acute kidney injury, it is like certain kind of, let me show you the previous diagram. Yeah, this picture, see this picture. Okay, so this is the post-renal acute kidney injury. So the post-renal acute kidney injury will be just after the kidney. It might be in the ureter, bladder, or the urethra, or in the prostate in case of men. Okay, so let me go back to our um, post-renal kidney injury slide. So this the post-renal might be because of the certain kind of obstruction, like because of stone, malignancy, or obstructed catheter inside the urinary area, bladder. Okay, so this post-renal acute kidney injury is going to, it accounts for the 5% of total AKI, and it may be ureteric, like maybe because of calculi or stones, blood clot. Means basically in post acute kidney injury, in post renal acute kidney injury, there will be blockage, there will be certain kind of clot in the blood vessels, sorry, in the urinary bladder area, or in the ureter, or in the urethra, or in the prostate. Okay, so that will is going to block the passage of urine. Okay, so neurogenic bladder, prostatic hypertrophy, calculi, cancer, or the blood clot. And in the urethra, structure, congenital value, or phimosis are the reasons for the blockage of post-renal areas, and that is going to cause post-renal acute kidney injury. So what is the pathophysiology for this PAKI? It involves hemodynamic alteration, okay, and that will be triggered by an abrupt increase in the intratubular pressure. And an initial period of hyperemia from afferent arteriolar dilation is followed by intrarenal vasoconstriction from the generation of angiotensin 2, thromboxane A2, and vasopressin, and the reduction in nitric oxide production. So this is the pathophysiology for the post-renal acute kidney injury. And because of that, what will happen in post-renal acute kidney injury? Reduced GFR is due to underperfusion of the glomeruli, and possibly it changes in the glomerular ultrafiltration coefficient. So approach to a patient with acute kidney injury. If any patient is going to come with the acute kidney injury, so how will you approach that patient? So we'll take the history first. Okay, we'll take the history of the patient. Okay, and you will ask for the exposure to the certain kind of nephrotoxin, what kind of drugs they are taking. Okay, what kind of antibiotics they are taking, if they are on steroid or not. Okay, you will check all these components. Okay, and anuria may indicate post-renal causes. Skin rashes may indicate allergic nephritis. Evidences of volume depletion like diarrhea, bleeding, pelvic and per rectal examination. Look for evidence of abortion. Ischemia or trauma to the legs or arms may indicate rhabdomyolysis. Okay, so these are the some essential parts that should be considered before treating the acute kidney injury patient. Then, a history of prostatic disease, nephrolithiasis, recent surgical or radiological procedures should be considered. Past and present use of medications, family history of renal disease, all these things should be asked from the patient. The history should be taken. Only then the further treatment can be planned. Okay. So, what kind of physical examination you can perform on the AKI patient should be, you should be focused to rule out the possible differential diagnosis like the pre-renal. For the pre-renal acute kidney injury, it is suggested by clinical signs of the intravascular volume depletion, example orthostatic hypotension, rapid pulse and poor skin turgor, certain kind of congestive heart failure, okay, example raised JVP, okay, jugular venous pressure, and S3 dependent edema, and S3 and dependent edema, and the pulmonary rails are the certain these kind of signs should be suggested by the clinicians for to be seen in the in case of pre-renal acute kidney injury. So acute allergic interstitial nephritis is suggested by signs of allergy, example orbital edema, eosinophilia, maculopapular rash, and wheezing. So these kind of complications should be monitored very closely for the treatment plan. Okay, so diagnostic workups, what kind of diagnostic procedures we are having, what we can do to confirm whether the person is having acute kidney injury disease or not. So for that we can perform urinalysis. In that, microscopic examination and the microscopic evaluation of the urinary sediment will be done. Okay, and the microscopic examination of the urine will be done to check the availability, what kind of substances are available in their urine, and based on that the results can be suggested. Okay, diagnostic test can also be performed. Urine and blood chemistry should be performed to check the what kind of AKI they are having. Okay, the certain kind of imaging can also be performed. Doppler or the ultrasound can be done to check the acute kidney injury. Okay, so how we can prevent and treat the acute kidney injury? So what are the prevention and treatment methods we are having? So how we can manage optimization of hemodynamics, correction of fluid and electrolyte imbalances, discontinuation of nephrotoxic medications. Okay, if patient is taking nephrotoxic medication, that should be stopped immediately. Okay, dose adjustment of administered medications, management of life threatening complications, like if patient is having certain kind of heart disease, heart complications, or myocardial infarction, congestive heart failure, certain kind of heart block, that should be that should be given priority. Okay, so diagnosis and specific management of underlying cause, renal replacement therapy should be continued. Certain the effective modality should be chosen for the patient, which can show more and more good result for the patient. How we can prevent the acute kidney injury? Being aware of patients who are at risk for acute kidney injury, like elderly patients are at acute, like the elderly people or the elderly population are at higher risk for the acute kidney injury, so they should be monitored for that. Diabetics are at higher risk for the acute kidney injury. Post vascular surgery patients, the certain kind of renal failure, the chronic renal failure patients are also at higher risk of this abnormality. And those patients who are kept on multiple antibiotics, that should also be that those patients should also be monitored for the acute kidney injury. And use of preventive measures, like the cautious prescription of nephrotoxic drugs, aggressive hydration prior to chemotherapy, IV contrast, etc. And that should be these preventive these preventive steps should be taken to prevent the acute kidney injury. Giving prophylactic allopurinol or the resburicase. Aggressive surveillance, like close monitoring of urine output, and RFT means the renal function test, the urea nitrogen level, the serum creatinine level should be checked for the inpatients, and also for the outpatients the LFT KFT should be done on the in a certain regular duration. Okay, then AKI remains a medical challenge to clinicians and the researchers. Recognition of patient at risk, and we have to recognize who is at risk of having AKI. Okay, institutions of the preventive measures, aggressive surveillance, and early treatment of acute kidney injury will be much more effective than treatment of established acute kidney injury with RRT. So these are the references that you can go through. Okay, if you want to read more in detail, you can go through these references, and you can just go through the Cecil textbook of internal medicine, Harrison's principle of internal medicine, and the current nephrology and hypertension, the first edition. And you can go through these textbooks, and you can get more idea about these acute kidney injury topic. Okay. So yeah, so we have discussed in this particular session, we discussed about the pre-renal acute kidney injury, about the intrinsic acute kidney injury, about the post-renal acute kidney injury. We have discussed the pathophysiology of all these three types of acute kidney injuries. We have also discussed about their, their causes. We have discussed about how we can prevent them and who are at higher risk for having acute kidney injuries. Okay, so I hope you got this topic. And yeah, so that's all about the acute kidney injury. Thank you.